What is bone marrow transplant? So in bone marrow transplant, there are mainly two types: allogenic bone marrow transplant and autologous bone marrow transplant. So this allogenic bone marrow transplant is one of the key treatment modalities that we use for patients with several blood cancer disorders. Acute lymphoblastic leukemia or ALL and acute myeloid leukemia or AML are the commonest blood cancer disorders where we use allogenic bone marrow transplant as a treatment option. So these patients are initially treated with chemotherapy. So with the chemotherapy, we get the patient into a so-called remission. Or in other words, we control the disease with chemotherapy. But certain high-risk patients require further treatment with this allogenic bone marrow transplant in order to achieve cure. So without allogenic bone marrow transplant, these high-risk acute leukemia patients cannot be cured. In addition, certain other diseases like myelodysplastic syndrome, chronic myelomonocytic leukemia, and myelofibrosis are also treated with allogenic bone marrow transplant. Furthermore, some non-cancerous diseases like thalassemia are also treated with allogenic bone marrow transplant. So, how do we do this allogenic bone marrow transplant? One of the first and key steps of this complicated procedure is finding a suitable donor for the patient. So it's not very easy to find a donor who is having a same HLA typing as the patient. Initially, we do tests from siblings, that is from brothers and sisters. If a brother or sister is not a match for the patient, then we need to find a donor from the general public. So to find a donor, suitable donor from the general public, we need to have this stem cell donor registry.